Hi everybody, my name is Yasha Gupta. I'm a board certified radiologist, and today we're going to be talking about 10 questions that you should be asking at your residency interviews. Alright you guys, I just recorded this entire video without hitting the record button, and I'm like in shock, so we're going to take a second. Okay, number one. I think this is a great question to ask residents and faculty members, and I would ask multiple residents and multiple faculty members. That question is, what are the greatest strengths and weaknesses of your program? That's going to give you insight into how the residents really feel about what is good and what is bad about their program. And you will hear different perspectives from different people. I will say that a lot of times the answer to this question becomes the people. I love the people here. The people make this great. It's because obviously we have the best field. Everyone is amazing in radiology, but truthfully, it'll give you good insight into how the residents perceive their program, if they perceive it, what's positive about it and what's negative about it. And that usually kind of brings out really what everyone finds to be a pain point in their program. Because usually it's like a common denominator. Residents get together, complain about, oh, I can't believe we still have to do blah, blah, blah. And that's what'll come out when you ask this question. So good question to ask. Second question. How is the workload divided by residents and fellows? And attendings, I should say. And this goes for both procedures, complex cases, any of the cases on the work list. How does it get divided? Do residents also get to do these, high-level procedures? Do they also get to do these complex cases, advanced imaging? Or does it all go to the fellows? And do the attendings read anything on their own? Or is everything kind of read out with a resident or a fellow? Because different programs work differently. You might be reading side by side with a resident, a fellow, attending, everybody reading. You might have an attending that's sitting in their office and they only come in to do readouts. Depends what you want, depends what you like. I personally loved having my attending right next to me because I could ask them questions on the fly. I could run something by them. If there was like something crazy that came through, I could just have them look at it right there. And then the best part of it all was just building relationships with people, right? Like I got to be their friend. I got to learn about them. They taught me so much about like attending life that I would never have known otherwise just by being in the same room as them for so many hours every day. But every program looks different. And I think everyone ends up loving their experience in different ways. Like you end up liking what you know. And so since that's what I knew, that's what I like. But doesn't always have to be that way. And so just ask that question, how are things divided up? And then you'll get to know what your actual workday would look like, whether you just have to do bread and butter cases, plain films, or if you actually get to dip your toes into like body MR, these advanced cases, doing LPs, doing big IR cases, things like that. Or if you will be stuck doing little stuff. So that's a good question to ask. The next question is about how much autonomy do residents get and how do we learn to be confident by yourself? The reason I specifically asked this question is because if you are sitting side by a fellow or an attending, in my case, you might not have that sense of confidence or autonomy because everything that you have a question about, you can just turn around and be like, would you call that? Or should I not call? You can just run everything by them. And it's really good, like even now as an attending, especially in breast, I'm sure you have experienced this or you will experience this. Like we all do consensus conference where we're like, would you call this back? Would you pass this? Would you follow this? Would you biopsy that? Like we're asking all the time. And other radiology and other radiologists and other specialties are doing the same. But in order to ever work on your own and have confidence on your own, you do need to be able to make decisions when there's nobody else around. So how do you learn that? I mean, residency is the place to learn that. And so you want to ask, how do you get that confidence in your program? And the reason why I specifically asked this question is because many programs are getting rid of independent call. And independent call was really where I feel like I learned how to be a radiologist. I have videos about it and whatever, and I know that like everyone is like, well, programs that have it say that it's the best thing, and programs that don't have it say that that's the best thing. It doesn't really matter at the end of the day, but even if you don't have it, you have to have a way of being independent, confident, learning how to be a radiologist. I will say a lot of people bank on learning how to be confident as a fellow because that's when you're like on your own. And that is program dependent. I think that for me, I actually had more autonomy as a resident than a fellow just because the attendings were very hands-on in my fellowship, which is a good thing. It's not a bad thing. But I don't think that if I hadn't had any confidence building as a resident, I would have obtained that as a fellow. So don't only bank on doing that as a fellow. Make sure you have a way to learn how to be a radiologist in your residency because that's really what it's for. And on the off chance that you don't even do a fellowship, which you should do a fellowship, but if you don't do a fellowship, then you're never going to have that confidence. So yes, definitely ask about how you learn to be autonomous, independent, confident as a resident, and what are the avenues to do so. This part will definitely depend on what your interests are, but you should ask about any opportunities that exist outside of just the radiology residency to get involved with the hospital. So sometimes hospitals have like a GME committee, they'll have a quality improvement committee, maybe they're doing projects at the hospital level that, you know, radiology doesn't often have a seat at the table, but why not? We should have a seat at the table. We're such a big part of patient care. So ask about these things, you know, you should ask about getting involved, global health initiatives if you're interested in that type of thing, see what opportunities exist. And then also ask if these opportunities don't exist, is there a way to create them? Because sometimes you do have a niche interest and you want to explore it. And maybe programs have not had somebody that's interested in that already. They didn't have someone that was so interested in international outreach that they had a Rad Aid chapter. But maybe you could create that for them. And so learning, even just asking these questions will tell you how receptive the program is to a resident that wants to do something and what the avenues are to achieve those goals. This brings me to my next point, which is how does the program react to feedback from residents? So if the residents don't like something about the program and they tell the program director, does the program actually respond to that, or do they just say like, well, you know, suck it up, this is how it's always been done, this is how it's always going to be done, and we've always been successful, and we always recruit good residents, and blah, 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 the end. Most of the time, I think most programs are very receptive to resident feedback. However, not always, and I would ask, again, both faculty members about this, and I would also ask residents, because I'm sure that the residents, like I said, have their pain points that they all complain to each other about, and I'm sure that they have brought it to the program director before, and if they have, what has been done about it. So you should ask that question to see what your experience would be like if you want to improve the program, or if there's something that everyone is complaining about and that has not improved over so many years, what does that say about the program, right? So again, just some insight into what the program looks like. Speaking of changing the program, a really interesting question to ask is what big changes are on the horizon for the program? And now there are a lot of changes that could potentially affect you as a resident. Big things that I can think of right off the top of my head would be chairman change. That always creates some sort of like kerfuffle within the department. Program director change, that can also create some good or bad changes within the residency program. Adding an ESIR spot, getting rid of an ESIR spot, getting rid of an IR spot, adding an IR spot, getting rid of their IR residency, like the 2-year residency that has been sort of a thing that people are talking about recently, because all of these things will change your experience in the sense that you might have to take more call, less call, more people sharing one work list, less people sharing one work list. If you are someone interested in IR, any of those changes will probably affect you in some way. Oh yeah, a big change that's coming up that will affect you is the IR, or not the IR, the oral boards, and how our program's going to start helping you prepare for those, because that's a totally whole new world there. You should ask about that. In fact, if you haven't asked about it already at your interviews, you should be asking that from now on, because this is a big thing that used to exist, didn't exist for a while, now it's going to be existing again. And it's always interesting the first go around about how, you know, how programs are going to train their residents to pass these exams. So yes, definitely ask about the oral boards, because that's a big change coming to radiology boards, and so you definitely want to be prepared for that. That leads me very nicely into my next question, which is not just the oral boards, but how does the program prepare their residents for the core exam? The core exam is really hard, you guys. Like, I don't know how to tell you. It's like a really hard test. And a lot of programs tout a 100% pass rate, and that's incredible, like very amazing. But you don't know where you're going to fall into that, right? Like, you never know if you're going to be the first person to fail or not. You don't know that. I mean, when I took the test, I was like, this is a really hard, like I studied so much. I studied so much for that test, and I still didn't feel like going into the test like, oh yeah, I'm going to ace this exam. It's like a step exam. There's just so much information to know. It's incredible. And you have to know physics, and you have to know all of your modality. You have to know everything about radiology, and they will ask you the most obscure stuff, and you still have to know that. And if programs are not going to give you time to study, then that's a big red flag, in my opinion. Per ACGME rules, you're not allowed to have official time off to study, okay? But programs will still generally place their residents on lighter rotations. This is allowed. This is not like breaking any rules. They will take you out of the call pool, because who wants to be studying after being on call? Like, it's just not possible. And they will obviously do internal board reviews. They will often, I won't say obviously, they will often do internal board reviews, and they should be doing internal board reviews that the faculty give to make sure that you are ready to take the exam. So I think it's very important that you ask how much time that you get to study. And when I say time to study, I mean like, how long are you on these lighter rotations out of the call pool? Is it just a month before? Is it 3 months before? Things like that, because you really want to make sure that you are well prepared, and you can ask the senior residents if they felt like they were prepared for the exam, because I felt like when I took the exam, like I said, you're never going to feel 100% prepared, but I felt like I was able to study as much as I wanted to study. I felt like my program prepared me really well. My program did so many board reviews all the time, like so many board reviews. It was amazing, and I'm super grateful because I think that's the reason why I passed the test. They just really prepared us very well. So yeah, make sure you ask about the core exam. Again, officially can't take time off, obviously, but there are ways that programs will still prepare you, give you materials, and just make sure that you're ready. And that similar thing that question should be applied for the oral boards. Now, the oral boards will happen after the core exam, so the residency program may not have like time, obviously, for you to study for that, but they should at least start incorporating ways for you to feel confident about the oral boards. I hope that they are, at least. They should be. Something that gets overlooked by residents all the time is learning about the business of radiology. The reason why this is overlooked is because most programs are at academic places with academic radiologists, and that's amazing. That's where you're going to see complex cases. That's where you're going to see all sorts of crazy stuff because everyone's getting transferred in. However, there's a good chance that you are going to end up in private practice because more than half of the radiologists in the U.S. are in private practice. Now, it's important to know the business side of radiology because you want to know how you're going to get paid in the future. You want to know what big changes are coming to radiology as we face like this crisis of radiology shortage, and how are people recruiting, and are you getting paid enough for the work that you're going to do? You don't want to be in a position where you don't even know if what you're getting paid is fair or not fair for the work that you're doing. And that's true in academics too. Academics in general gets paid less than private practice. And as the volume in radiology in general, including academic centers, is rising, that pay differential doesn't really make that much sense, because if you're getting paid the same for each study, then if the hospital is getting paid the same, is my point, then there's no reason why one person shouldn't be getting paid the same as the other. My point in all of this is that no one is going to teach you these things unless you actually ask, unless you find out about it, until you do these things on your own. And you don't want to be stuck looking at your first contract or learning about these things for the first time when you're negotiating your first contract, if you are in academics or private practice. So residency is a great time to learn about these things, to ask these questions to all the radiologists around you that want to teach you. And and you can also see if there are like committees or things that you can get involved with in your hospital that sort of learn about the economics and business side of radiology, because there's so much that goes into it that you don't even think about. Billing, hospital fees, hospital negotiation, hospital contracts. There's just so much that goes into that side of it. And clearly I don't even know that much about it, and I wish I knew more. But residency is a great time to learn because you have all these resources at your fingertips. So I would do that if I were you. Last question, we're finally there. And this is more just like a out of interest question also, but who does the tumor boards? Are there interdisciplinary conferences that residents are expected to attend or run or go to? Who runs them? Fellows, residents, attendings? Who attends them? Do you have backup? What does your backup look like if they ask you a hard question? Because trust me, in tumor board I feel like is where the surgeons really come out and they're like asking you all these questions that you think you know the cases inside and out, and then they ask you something and oh no, now I'm not so confident. Tumor board is a great way to be more confident with these things. You can ask if there's a tumor board for for hepatobiliary, breast, chest, who's running all of these? Are they all separate? Do they have one big one together? Do internal medicine residents present? Do you have conferences with internal medicine? Because there's so much overlap, like screening guidelines, CT colonography, screening mammograms, lung cancer screening CT. These are all things that medicine people should also learn about, and then they can tell us about their, do I order it for a patient that has a 10-pack-year smoking history? And then you can, educate each other, right, on the indications and what this scan really means and how much the dose is, because that's a lot of the concerns from the ordering providers is about dose of mammography, dose of lung cancer screening, dose of CT colonography. And it's just, there's so many ways that you can collaborate with the people around you. And it's nice to be able to get that experience as a resident. And then also, when you go into practice, you will be collaborating with your surgeons and the people that are sending you patients, because that's just how radiology works. We really don't work in a silo. We talk to all these people. And so it's nice to start to do that as a resident too. So, okay, we recorded this video. We got it done. I hope that this was helpful. I'm still I can't believe I did all of that twice, but I hope that this was helpful. If nothing else, it'll give you some questions to ask in those awkward silence moments where you're like, I really don't have any more questions. But all of these things, I can't think, not just at face value what they tell you, but you can start to learn and read between the lines of what residents are saying at different programs, how they are answering your questions. You'll start to figure out a little bit about how each program runs and how it works, and if residents are generally happy. So I think this will officially close out my residency interview series. I hope that this was helpful. I wish you the best of luck. You're going to be fine. Radiology is the best. Congrats on choosing the best field. I will see you in the next video. Bye.